but have been some people hearing impaired and stuff like that that wanted this feature tried out. So we're doing it for them tonight. Anyways, we are here to talk about healthcare in Panama. And my history, I've been in Panama 10 years now. I moved here from Canada. I've been involved in several different businesses. My business partner, Oscar, and I have been doing tourism stuff and helping expats for almost 10 years now. And we now do group tours, maximum 10, 12 people at a time, show them all of Panama, and give them all the resources they need to move here. We do these Q&As every month, but we keep running out of time to answer the healthcare questions. And there's so many of it, and I meet so many people making the wrong decisions for them. And sometimes it's too late, and they already have a plan in place, or they prepaid one, or so, you know. So listen, good. We have brought on industry experts here tonight to talk to you about healthcare. First of all, we're going to talk about 3 different types of providing services for yourself. Number 1, we're going to talk about international health insurance that covers you here and around the world. That is, to me, just the ultimate healthcare insurance. I carry it myself. But it does get more expensive once you get older. It also has a 70 to 74, depending on the company, age cutoff that you have to enroll by. So it's not really for the extreme budget minded, and it's not for people over that age. So we have to look at other options. The second type of thing we're going to talk about is self-insuring. Is that possible here? How much money should you have to do it? Like, how much money do you need in your savings account if you really want to self-insure safely here? And the third thing we're going to talk about is local hospital plans. Just, you know, to have that little bit extra coverage that when either you don't qualify for an international plan or it's just too expensive for you, local coverage in the local hospitals is an option for you. So we're going to start out with, I'm going to change the view here so we can see. We're going to start out with, oh, wrong view. Just give me a second, guys. My Zoom doesn't want to be doing it. Okay. We're going to start out with international healthcare plans. I'm going to introduce to you a lady. Her name is Magda Crespo of Magda Crespo Insurance. And don't worry, after this call, you are all getting the contact details of all the people we have talked about and everyone you have met, how to get a hold of them, if you want quotes for yourself or if you have questions for them, you're going to get that in when the recording goes out tomorrow. And Magda, Oscar and I have known Magda for, well, 12 years for Oscar, 10 for me. She has been our go-to lady in the health insurance business. The main reason why, we just find her to be 100% honest. You know, people ask Magda, so what insurance companies do you represent? Her answer is quite simple. I represent the ones that pay. And to me, that's integrity. She doesn't represent the ones that give her the biggest commission. She represents the ones that are good and pays your claims. That's what's important. You don't want to, you can say, oh, I bought health insurance, it was $52 a month, and I'm going to go get my heart stent in, and I have to pay it, and they're going to reimburse me someday. You don't want health insurance like that, because you're just going to get in trouble. I know a lot of people that have been stung by a lot of these online health insurance companies. And Magda is honest with our guests. She tells them, you know, what she thinks they need and shows them all the different options of the different plans. We're going to hear some different names here, especially people from the US, insurance companies that might not have heard of. That's because we deal with international companies. Big companies like Worldwide Medical, MapFree. I could go on. Magna will probably name, you'll probably hear she'll name drop a few more. These are the big international companies that provide healthcare insurance to residents of countries outside of the US. And so I want to pass things over to Magda. I'm just going to ask her to unmute. There we go. You're unmuted.
Okay, can you hear me?
Yes, I can hear you. So, Magda,
Okay.
how long have you been in this health insurance business?
I've been at least like 20 years because before I used to work for one of the companies. So
Mhm.
that's how I know the know-how of the insurance, health insurance specifically.
Yeah.
And selling insurance, I've been already 15 years or so.
Yeah, Magda owns her own company. She lives in David. She has an office in Boquete. It's called Magda Crespo Insurance. It's available. You don't have to live here. Like you can get insurance over the phone. You don't have, she can guide you no matter where you live throughout Panama. So just like what I've asked you, Magda, is I'm going to ask you some questions after. No, I'm going to ask you them now. Why, like, Panama has a public healthcare system, public hospitals, and it has private hospitals. You sell insurance for the
Mhm.
hospitals. Why don't you think expats would want to go to the public hospital? It's so much cheaper.
Public hospitals are really a bad situation you don't want to end up to. There are too many people with not enough workers, not enough medicines, and to tell you situations that happens. For example, 2 months ago, the air conditioning was broken. So can you imagine a hospital with more than 500 people with no air conditioning in it? And then there are so many people that, for example, my own experience, one of my uncles went there because he had a very bad chest pain. And because they saw him pretty well, they told him, you have to wait. And he waited not less than 5 hours. And when they called him, he was already dead on the chair. So
Hmm.
it's a very bad experience. Panamanians who can afford to have a private health plan, they do, because we don't want to go through that. There is sometimes one nurse for one level of 60 patients. Can you imagine how can that nurse serve 60 patients in her shift?
Yeah. No,
So
I
the
understand.
situation is pretty
So
bad.
in the private system, what are the facilities like? How modern are they? Do they have, are they staffed right? Do they have medicine, like all the medicines you need?
They have medicine, they have very updated equipment. For example, in Panama City, two hospitals have the Da Vinci, which is the surgery machine, Hospital Nacional and Panama Clinic. They are even graded by the John Hopkins Hospital in United States, works along with Punta Pacifica. They couldn't do so unless they were certified by them, so they are. And they are pretty good doctors. Most of them actually study and specialize in the States, so they speak very good English and they know the latest treatments and procedures.
Right on. Okay, I want you to get into. I might stop you and ask you the odd question just to make sure we're clarifying things for everyone. But I want you to get into full international coverage, like the two
Mhm.
types that you have: the complete international coverage and the catastrophic international coverage. So if you can talk about those, like what's available and what do they cover and everything like that.
Okay, we have two different plans, the security and the exclusive. The exclusive is like a catastrophic plan, but let me talk about the security plan first. It's a more complete plan, and this company is called Worldwide Medical. It's international. It covers at 100%. There are no co-payments, and there is no deductible for emergencies or accidents. When you most need it, it's 100% covered and no deductibles. What would it be an emergency? Very high blood pressure, dehydration, food poisoning, a snake or scorpion bites, a broken bone, a cut, concussion. Those will be examples of emergencies. You rush into the ER, you show your carnet, and that's it. You get in and everything will be covered. So the security plan also covers for pregnancy, for those women who are still wanting to give birth. This plan covers $3,500 for this procedure and the treatment at zero deductible. So it's a more complete plan. It has deductibles for outpatient or ambulatory expenses, such as doctor's visits, lab tests, x-rays, or prescriptions. Deductible goes from $1,000 per year calendar from January to December, all the way to $5,000 deductible per year calendar as well. So in Panama, most of the best hospitals work very well with this company and this plan. See? And remember, for emergencies and accidents, you are fully covered, zero deductible. I had a client the other day say, he asked me, Magda, I have a hernia and I need to have surgery. What do I need to do? Well, you have the security. We fill up the pre-authorization with your doctor and you program your surgery next week and that's it. Off you go. So simple as that. You really pay for a good plan and a service, but it gets better.
Does a plan like this cover doctor's visits?
No. Ambulatory expenses will be covered after you meet your year deductible.
And how much is that typically?
The minimum is $1,000 and the maximum is $5,000. But let me ask you, Rod, how many times a year do you go see the doctor?
Once every 3 years.
There you go. What we really need is a policy that will really cover us when we most need it.
Yeah.
And this is what this plan does. But it's also international. So once you leave the country, you have many benefits with this policy. With this plan, you have a life insurance benefit of $10,000, a travel assistance benefit of $10,000. And if there is a couple and the holder of the policy dies, their spouse or husband will still be covered under this plan for 3 more years for free. See? So it really has many benefits. With a travel assistant, if you leave the country for maximum 2 months, you will be covered at zero deductible for $10,000. If whatever happens to you outside Panama is more than that, then the plan kicks in and you cover the deductible and the plan covers the rest. But it also have what we call selected providers. If there is a procedure, surgery, for example, cancer, and you want to be treated in the States and you choose our selected providers, instead of $5,000 deductible, you only pay $2,000. And part of our selected providers is the Mayo Clinic, Cleveland Clinic, Mount Sinai Hospital, Yale Hospital, and other very good hospitals in the States. And I have had cases of clients with situations in Hong Kong, Thailand, Canada, France, Germany, Mexico, you name it. The plan really works. And this is the full plan, the security plan.
That's the security.
The security. But of course, as you said, Rod, the plan gets higher as you age. So we have now a catastrophic plan called exclusive. And I think it's a very, very good plan because it covers fully 100% at zero deductible in Panama for any emergencies, accidents, hospitalizations, surgeries, COVID-19, and it also covers treatment for cancer like chemotherapy and radiation therapy. So to be a catastrophic plan is very complete. And like I said before, in Panama, the exclusive plan has no deductible. So when you most need it, it's there.
So what are the big differences between security and exclusive with this company?
Will be that the security will cover the ambulatory expenses once you cover the deductible.
Once you reach $1,000, yeah. And
the
does
exclusive
ambulatory cover prescription drugs?
It covers prescription drugs at 80% after the deductible, after the security.
So doctors, visits, tests, all stuff like that. But you got $1,000.
And the exclusive does not cover ambulatory expenses. It will only cover like the emergencies, the accidents, hospitalization, surgeries, chemotherapy, and radiation therapy. But it's also an international plan. And the exclusive, when you leave Panama, becomes a complete plan covering everything after deductible. See?
So kind of these plans you're talking about could become your Part B medical if you're from the US.
Definitely they do. And we have worked it out that way before with other clients that have Medicare and they went to the States to have surgery. Their primary plan is Medicare. But whatever Medicare didn't pay for or didn't cover, the worldwide medical plan takes and pay for.
Yeah, that's a big expense for many expats moving here from the States. A lot of them are told to keep their Part B, keep Part B. Well, it's costing $160 a month now starting January for each person.
Well, and that doesn't cover.
Plan, as long as they're not going to move back there because you're penalized if you cancel.
But it doesn't cover in Panama. So this plan from Worldwide Medical covers in Panama. And instead of paying the supplement for the Medicare, you put that money into the Worldwide Medical plan, and then you will be fully covered in Panama and also in the States.
Yeah. Okay. That's pretty good. So I've always wondered how much cheaper, if you do percentage-wise, is exclusive, which is the catastrophic one, to the security, which is the full one. For a guy like me, I know exclusive is $1,800 a year. How much would the security be?
Security will be like $3,000 a year.
Well, that much more.
Uh-huh.
Yeah. Because people are using it for all those less. Yeah. Okay. We're going to get into prices, sure, very general, because everyone's different, guys. So I'm going to give you age ranges of quotes that make that Magda has done for us and stuff like that, just to give you an idea of what it's going to cost for this full coverage. I personally love it, full coverage, because I don't have a care. Anything could happen to me tomorrow, and I'm not going to have to start a GoFundMe to pay for my hospital bills, or I'm 100% covered. But when I'm 70, 75, it might get a bit expensive. That's, you know, my only concern. I can afford
it does get
$1,800 a year.
It gets expensive as you age. For example, a 70-year-old person with the catastrophic plan will be paying at least $6,000 per year.
Yeah, so $500 a month.
Uh-huh.
For somebody 75.
That's correct. So it does get expensive, but
so what every 5 years, right? Every 5 years there's a price hike for the base plan.
Every 4 years.
Every 4 years, and then at 75 it stops, and then it's just cost of living inflation type increases.
That's correct. That's correct.
Okay. What else do you have to say about it? We're going to have a lot of questions that I'm going to ask you right now that people have typed in.
Oh, I do want to explain the difference between the local plans and the international plans. In Panama, we have something we call URRAs. That means usual and reasonable prices of the market. The local plans have low URRAs, and the international plans, because they are international, they have higher URRAs. So for example, if you have an appendicitis and the doctor said it's going to cost $7,000, the local plan may come and say, yes, we cover that, but we only pay $3,000. Then you end up paying the balance, which is $4,000, the $500 deductible, and the 20% copayment. And then you come back to me and you ask me, why do I have this plan if I end up paying more than half the bill? The international plan instead, because they have higher URRAs, they will go ahead and pay the $7,000. And that's it, end of the story.
Yeah, that makes sense. Let's talk about pre-existing conditions. The question is diabetes a pre-existing condition?
Yes, diabetes is a pre-existing condition. And I do have to say that if you are a insulin dependent, you won't be covered. It's an exclusion. Diabetes 2, people that takes, for example, metformin, their pre-existing condition will be analyzed, and then the company can come back and say to you, yes, we will cover you, but we will give you a waiting time, 1 or 2 years, or they will say, we will cover you, but we're gonna have an extra premium add to your plan, or they come back and say, no, you are excluded because you might not have only diabetes, but high blood pressure and high cholesterol, and all those things makes higher the risk. But Worldwide Medical, the international company, will analyze every case separately. And that's another issue. Local companies, they will exclude those things immediately. See?
Okay.
And it's
go ahead.
It's hard because at this age, every one of us sometimes have some pre-existing condition. Some diabetes, some high blood pressure, some cholesterol, something. But this company has been covering the expat community even with those pre-existing conditions, and they honor their word.
That's the key, folks. You want a company that is going to cover you. If you got a high blood pressure and you've been on pills for it for years and it's under control, you're still going to get covered by these guys. There's some other companies out there that will. I just found a guy that he sent me an email. I can't think of the name of the company. Not Cigna. It's one of the other big ones. He spent
Aetna.
Yeah. What's that?
Aetna.
Yeah, Aetna. He spent $300 in medical tests, which they required him, and they denied him for something silly like high blood pressure and cholesterol. So, yeah. So he might be calling you, Magda.
Okay.
Tests were overly expensive too, like $350 were the tests that he had to take.
I see.
What is the age cutoff for Worldwide Medical?
Everyone who have to get a health plan have to get it before they turn 75.
75, okay. Perfect, that answers Karen's question. Yes, you will. Joseph asked, you keep referring to local hospital or government insurance. There is no government insurance here. but doesn't cover doctor's visits. We just discussed, Joseph, a company that has two policies. One, they do cover doctor's visits after a $1,000 deductible, and their other policy, they don't. But doctor's visits here, even what Magda said, unless you develop something and you're going to the doctor every 2 weeks and you're getting tests and you're getting, and it's a whole bunch of serious stuff, you're probably never going to use that $1,000 deductible. A doctor's visit here in Boquete, it's $12. And a specialist in David is what, 75 now, top end?
60, yeah, 75.
60, yeah, for a specialist. I can get a blood test done here for $12, an x-ray for 15. Things aren't that expensive here. So opting for not having that stuff covered to lower the rates is sometimes a good idea. But, I don't take any prescriptions. And if you do take prescriptions, if you're already on prescriptions and you get covered by if you go for the security plan, will they cover your prescriptions after a certain time?
They will cover prescriptions at 80% after the deductible.
Deductible, yeah. Mm-hmm. So some of you, that might, be what you need it. Okay. Cost of doctors, we talked about. International security deductible would be, okay. This is, we're talking about the security plan. When would the deductible be 1,000? When would it be 5,000? It depends what you select, and you can select a higher amount internationally if you want to lower your cost. Is that correct?
That's correct.
So I can have $1,000 here in Panama and 5,000 in the States.
No. You can have 1,000 in Panama and 2,000 in the States. That's the first.
That's the first.
The second option will be 2,000 in Panama, 3,000 outside Panama. Okay. And the third option is $5,000 in Panama and 5,000 outside Panama.
Yeah, okay. So that's the deductibles.
Mm-hmm.
Let's talk rate ranges. I'm just going to rattle these off. I could show this. My insurance, I have full international coverage, okay? I have since I've been here. I got it when I was 51, I believe it was, and I was paying $108. I turned 55, and Magda gave me quotes on this too, and they were identical, and of $158 a month. Oscar has MAPFRE, another company you represent. It works well for Oscar because it covers him in all Latin America and Colombia. So he's from Colombia. Yeah. He pays $82 a month. He's in his 40s. Now, I have a quote here from Magda. Share my screen. Just give me a second, Magda. Mm-hmm. And I think she was humoring herself. I should be able to see my screen now.
Yes, I do.
The client is Rod and Oscar, Mr. Rod and Oscar Larrabee. Okay. Now, this would have been a slight increase of rate since then. Oh, I didn't calculate this. Okay, this works out to somebody 65, a male 65, $280 a month, a female 62, $220 a month. So that's kind of your ranges, starting in your early 50s from 100, mid 50s 150, 60 220, 65 almost 300, and then it's going to go into 70 400, 75 is your top end at 500. So that is for your like premium, top of the line. You're covered for everything. You're comfortable. You can travel and do everything.
Yes, I personally have the security plan, and let me tell you, I have used it a lot. Not that I'm happy about it, but once I had a kidney stone, very painful. I had to rush to the ER, and they kept me 3 days at the hospital, and they did a scan to make sure the stone has out. But they also found out that I have gallbladder stones. And they told me, you have to get that out too. I said, oops, well, can we do it next month? Sure. And that's what I did. I pre-authorized it, and next month I had the surgery. I don't even know how much it was because the company paid it in full.
Yeah. See, maybe because I'm a Canadian is why I'm comfortable with this type of insurance. But the one thing that is so un-Canadian here, let's say, Magda, I needed knee replacement surgery. How long would I have to wait? In Canada right now, the waiting list is about 2 years.
Eesh.
How long would I have to wait in Panama?
Did this have to do with the pre-existing condition?
No. I've had insurance for 10 years here, and I got in a car accident, and now I'm going to have my knee replaced.
Because for knee replacement, you will have to wait at least 1 year.
Yeah, after you start.
Because, yeah, this is not something that happens in 1 year. It's usually something that is building up from at least 3 years.
No, I totally understand that. But my question is, I've been paying my insurance. I've been with Worldwide for 7 years. I now need knee replacement insurance. When can I have it done? How long do I have to wait? What's the wait list in the hospital? Or can I get it done?
You can get it done within 2 days.
Yeah. Mm-hmm.
We just need to authorize the doctor. No waiting list. No.
You just need to get it approved and then find a doctor willing to do it.
Yes, and you can have it done in Chiriquí or in Panama City at the Johns Hopkins Hospital, in the best hospital.
And I pay nothing out of my pocket.
Nothing. Prostheses and everything is included. Right now, the cost of knee replacement is around $17,000. Mm-hmm. And you go in and you pay nothing.
Okay. What about physiotherapy afterward?
Physiotherapy, the company covers 20, maximum 40 sessions. And okay. After the surgery. So
okay. Thank you. I have to clarify, some people are confused on the age restriction, the 75 years. The age of maximum age for enrollment is 75. You have to enroll the plan on your 74th, like the day before your 75th birthday, and you're covered for life. You don't get cut off when you're 75. That's just the maximum age of enrollment.
Correct.
Yeah.
Correct. Mm-hmm.
Yes. Okay, Patricia and Carol and everyone. Yeah. What are your opinions, since you're from Debbie, and I'm sure you referred many people to hospitals there, what is your opinion on the two private hospitals, Cherokee and May Lewis, compared to private hospitals in Panama City? Would you recommend someone to go to Panama City instead of going to Debbie, or does it depend on the procedure?
With me?
Yeah, like what's your feeling on how good are the Cherokee hospitals compared to the Panama City hospitals?
Cherokee Hospital and May Louis are very good hospitals. I have had my surgeries there, but when it comes to something more difficult like cancer, I rather have people going to get the treatment in Panama City. Mm-hmm. The other day, I had a patient also that had an accident with a wooden stick in his eye. Oh. And they did surgery here in Hospital Chiriquí, but it's still not very well. And I said, okay, now it's time to go to the city. So he went to Panama City and they did another surgery there. And finally they fixed him. So it depends really on the situation. For cancer, I wouldn't hesitate to go to the city. But knee replacement, hip replacement, heart surgeries is okay in Chiriquí.
Perfect. Okay. There's more. I'm going to get into some of the other things you guys asked in the chat. But I just wanted to know if you guys want to ask a question, feel free to unmute yourself one at a time. And if you got a question directly, write to Magda and she'll stay with us for about 5 more minutes.
I have a question. The thing I'm not understanding is my husband and I, if we may not be able to go to Panama till we're 75 or 76. So what happens after 75? Are you not covered at all? Can you not apply for insurance and be covered? I'm not understanding that.
Oh, you cannot apply for the insurance we're talking about right here, international.
Well, what do you do?
You stay on the call. We talk about the other options.
Oh, thank you.
Yeah.
Okay, thank you.
Yeah. See, in international health insurance companies are not like the U.S. They're not like Canada at all. These are companies. Where is Worldwide from? I know MAPFRE's out of Spain. Worldwide's from where? Oh, sorry, I muted you accidentally. There we go. Yeah.
Okay.
Yeah, where is Worldwide's head office?
It's from Dominican Republic, but their major shareholder is the Bank of Germany.
Okay. So these are not U.S. companies. They're not like, they don't work like it. They have cutoffs. They have pre-existing condition exclusions, just the way it is. And it's not Panama. If you're moving to Costa Rica, to Ecuador, to Portugal, you're going to be dealing with these companies. And like the same companies that we're going to be, that Magda's been talking about. It's just the way it is. So they have cutoffs. Some are as early as 70. Worldwide is 70 by 75. So, you know, if you want that type of insurance, you need to get down here when you're 74 and, you know, get that done.
Ron, this is Dan Jampo. I got a question and maybe going to discuss it later regarding dental insurance. Does that exist in Panama or are we going to or not?
Outside of emergency dental, not really. They're not dental's basic dental coverage is not covered in any of these plans, correct?
No. Some local plans have some $150 per year to cover maybe some cleansing or something, but it's not really covered, neither glasses.
Yeah, no dental glasses. A cleaning is $35, a cavity is $45. Who's had a root canal done in Panama? I can't, someone told me what it was. I don't want to say it if I don't remember because I can't remember. Do you know, Magda, what does a root canal cost in Panama?
I think it's costing around $800 to $1,200.
Yeah.
And a crown would be $200 to $400. $200
to $400 for a crown, yeah. Mm-hmm. Okay. Any other questions for Magda before we let her go for the evening? And she's got to get off that beach she's on.
Ron, this is Kim. I have a question. I'm a U.S. citizen. I'm working remotely out of Boquete. I have corporate insurance in U.S. I'm 60 years old. I don't think U.S. insurance covers me in Panama. What do you recommend?
Well, it all depends what type, if your insurance is covering you for your travels. And that you got to watch because usually they have a maximum number of days.
Yeah, I don't believe it does because I'm living here full time.
Oh yeah, if you're full time, do you have your residency?
Nope, I'm 60 years old. I'm too young.
Oh no, yeah. Oh, you can't buy this insurance without your residency. Yeah, you actually have to be a resident. We didn't talk about that. You got to be a resident of Panama to get insurance from these companies.
And another
pensionado or jubilado. I have to have one of those.
Any type of residency, yes.
Mm-hmm. At least you have to have apply with your lawyer for residency. Yeah. That's the minimum request. But now that we're talking about it, the policy states that you have to be in Panama at least 6 months of the year. You can spend the other 6 months in Mexico and you will still be covered because it's international and it's portable. But the exception is Canada, United States, and Brazil, where you can only be for a maximum of 3 months in a row.
Right. So I'm here full time for 5 years. I'm 60, so I'm not eligible for retirement. So it sounds like I'm sort of like up the creek without a paddle.
We're going to talk about the public healthcare system for you, buddy, for the next 2 years. Don't worry, I've been there.
Yes,
okay.
I like this.
I just wanted, guys, this reminded me of a very important question in the chat. Somebody who wants to live in Panama 6 months and back in the States. This is why the major insurance companies require residency now, because people were coming here, getting insurance, and not actually living here. And their insurance, like people in their 50s and 60s that weren't covered under Medicare and were paying $800 a month in the US for insurance, they were coming here and getting a $200, $300 package and using it back in the States, and they had to stop that. And so that rule is you can only be 3 consecutive months in a row in the US with this insurance. So you could go 3 months here, 3 months there, 3 months here, 3 months there, fly back and forth twice. You could get away with that, but that's the maximum. This insurance is not for, it's difficult for the snowbirds. I really, I've talked about many Canadians that come down here for only 6 months. It's a difficult insurance thing. Okay, I'm sorry, I cut someone off there. Please, can you ask a question?
This is Joe Cahill. I'm retired in Costa Rica, and my wife's from David. Yeah, and I've been coming to Costa Rica probably 25 years. I'm on the CAHA plan here, which is the government insurance.
Yeah.
And I also kept my Medicare B in the States because you have a give back plan, so you don't really end up paying that much just for an HMO. But my question, in David, let's say you're a teacher pulling in 15, 20 grand a year. Those teachers or government workers there, they have to buy private, I guess. There's no government plans?
Well, there's government plans here if you're part of the Social Security system, meaning employees pay into it, and they do get free medical in the public system.
Okay, so it's not like Costa Rica. Once you're a pensionado, you don't become part of the system. Here it's mandatory. Once you're a resident here, you must buy the insurance.
Yeah, Costa Rica mandates insurance.
It's not that expensive, but
yeah.
Okay, so I guess that answers. So you really have to, if I moved back, well, if I went to Panama, she'd like to return, I'd have to buy something to be covered there. And at age 69, I'm looking to spend probably, from what you're saying, maybe $350 a month.
Yeah, like if you want a full international plan.
Yeah.
Well, I need something just to be covered there. It's either I go out of pocket, straight out of pocket, but that gets expensive for hospitalization. And doctor visits, like you say, they're about the same as here, private. It's after that you need something.
Yeah, definitely, for sure.
Yeah, Medicare is not going to cover you any place outside of the States.
No. Okay, well, we're going to wrap it up. We got to keep on track here, or we have another guest speaker in 15 minutes, and I got a few things to cover. But guys, thank you, Magda, for sharing with us. I just put in the chat if you guys want to send Magda an email tonight. But tomorrow, you will also get her contact information. For those of you, I know a bunch of you are on this call and you're in Boquete and stuff. Her office is San Francisco Plaza. Feel free to pop in, make an appointment, and she'll be happy to talk to you. Please, because of this call, and not only is there's 100 and some people on this call, it's going out to a list tomorrow of 5,000 and some people. Please give Magda 72 hours to return your email, because she might get a lot of responses tonight. But thank you very much for joining us here, Magda. I think we've got a lot of questions answered. I just got to go to the chat and answer a few more. And we appreciate you, Luis. What's that?
It's always good to have a chat with each person because they have different situations.
Yeah, everyone has different needs. Yeah, for sure.
It's better an appointment or send me an email and I will answer it like Rod said, within 72 hours or so.
Perfect. All right, thanks. I want to talk to you about the important, I'm going to bust a myth here. If you buy, Magda and I posted in the chat, Worldwide Medical. Now you could run over to Worldwide Medical and get a quote from them. Go right ahead. Then go to Magda and get her quote. Guess what? It's going to be the same. They don't, insurance agents here aren't all crooks. And obviously Magda isn't. They charge you, they earn their commission from the company. They charge you the exact same as the company charges you. So you won't pay 30, 40% more. I guarantee you that. Thank you very much, Magda. And I'm going to answer a few questions. Have
a good night.
Good night. Bye-bye. I think we have our next guest. Oh yeah, I see you, Carla. I'm going to move you to the front screen here. Give me a second, guys. I'm going to answer a couple questions here that were in the chat. And if you guys not answering that, assisted living homes, guys, you really have to realize this is not North America. Panamanians do not put their parents in assisted living homes when they get old. That's not done in Latin America. It's not done anywhere in South or Central America. So Boquete has a need. Entrepreneurs, get a hold of me and Oscar. We've already been talking about this. We have a need for assisted living homes. We will have, because in the last 20 years, thousands of expats have moved here. Now they're all aging. Now, one opened up in Devi. Magda knows it well. And it opened up about 10 years ago. And they're always full. It's not that big. I think it's a 20-bed unit. They charge $1,000 a month. For full assisted living. Well, not really assisted, like full living. And so those, growing old by yourself, Panamanian style would be to bring someone into your home for a few $100s a month to look after the elderly. That's done here a lot. You'll see a lot of homes in Panama when you're looking at bigger 2-bedroom, 3 bathrooms. They also have something off the kitchen, a bedroom bath. That can be for the maid. It can be for the assisted living person too. Not necessarily a nurse, but somebody with experience dealing with older people. Okay, they have home doctor service. Home doctor service. Some doctors here make house calls. I haven't heard as much in Panama City. I think it's more of a country thing. Anyone live in Panama City and get doctor's house calls? Okay, we handle that 75 issue. Insurance and Canadians, yeah. I don't know what that is. Anyone got any questions? You should be able to unmute yourself.
Hi, this is Phil. Can you hear me?
Yes, Phil.
Yeah, we were thinking originally of spending like 7 months in Boquete and 5 months at a residence here in Florida. But I'm concerned when I just understood that we needed to have a 3-month window in the States. So could we spend 7 months here, go back to the States for 3 months, then come back to Panama for like 2 weeks, and then go back for the balance? Or how would that work?
Yeah, the way it's worded is 3 consecutive months at a time. It's worded exactly like that. So that's exactly what you could do. You could go back for 3 months and come back here. And just, you got to be careful that don't push it to the day. Insurance companies, what's their number one goal?
Not to pay.
Exactly. And that's why you need a Magda on your side so she can get involved. And especially, this is an international insurance company that their operators don't speak English. I'm sorry. If you need help with them, you need an agent. You need someone like Magda and Carla, who I'm going to introduce you guys to.
Yeah, no, I intend to meet with Magda and Boquete when we go. No question.
Perfect. Okay. Spend 7 months. There's something. Someone's talking about the Part B plans. Yeah. You guys' Medicare Part B goes up to correct me if I'm wrong, 155 in January, 160. Now what, you have to be sure you're not moving back to the States, that you decided this is my home. because if you cancel Part B, to get back in, there's a big fine. So, but if you were to cancel Part B, that $300 premium wouldn't be as painful if you could put that $160 towards it, because your international policy will be your Part B if you ever return to the States for care, or if you needed care when you were visiting.
Do you know that Part B will cover you for an emergency visit to the hospital outside of the United States, no matter where you are?
It all depends on what other parts you have with it. But if you are traveling as in the word vacationing, yes, you can be covered.
It doesn't matter.
Yeah, it does. If you live as a permanent resident outside of the USA, Medicare is not going to cover you.
Well, you don't become a resident.
Well, no, exactly. That's what I said. Most people live here as a resident. You can decide. I never advise people to try to, what's the right word? Cheat the government. You are. If you fill out a tax return and you live here, but you have an address in the States, and there's right on the tax form, it states, do you live outside of the US? Like, yes, no. So there are some things that, like Medicare, like the gentleman was saying, like, especially if you're trying to decide to come here, and if you're traveling here and there's an emergency, for example, even if you're been looked after for a heart problem and you actually have your heart attack here, sometimes those things can be covered under Medicare. But once you make that,
it's another option. You can pay private for hospital visits, etc. Keep the Part B for hospitalization emergency.
Yeah,
just another option.
Okay. Michelle's asking, do we have something in writing? This is actually going to be, this is being recorded. So there's a recording going out. The recording, I'm not sure if a transcript can possibly is also being recorded. Lots of spelling mistakes though. I'm getting close to the question so far. There we go.
I have a question, Rob.
Sure. Go ahead, Danny.
I'm from Canada, and just before departing from Canada to live permanently in Boquete, I had an MRI, and I just received 2 weeks ago the information from my specialist that I need a ampullectomy by endoscopy. So I'm wondering if I get my insurance today, is the insurance will pay for that surgery, or because I already know and I take the insurance after?
Yeah, there's definitely going to be a waiting period for any for stuff like that. You're going to have to meet with a doctor. What's your age, Danny?
55.
Okay, then you might not have to meet with a doctor. So, yeah, no, I don't think you have to meet with a doctor until you're 60 with Worldwide. So
because you just say that they have to remove the ampulla because it's what do you call that? The word in English. I'm French, by the way. It's a tumor, but it's apparently by the MRI it's benign. So, but it needs to be removed as quickly as possible.
Yeah.
So, and I don't want to return to Canada because my expense will be a lot of things because I don't have anything more in Canada. I just sold everything. I'm here permanently.
Well, all I can tell you, Danny, is I can't tell you that answer because I have to tell you to be truthful, filling out all the forms, and you're going to get asked those questions. Do you have anything like this? Because you're going to have to you're going to have to get an MRI here. You're going to have to go to a doctor. You need a reason for the procedure that you have done. So they're going to need medical backup for why you need that. So
yes. So that's what I was thinking, that I can redo all the exam here. So I have like a doctor diagnostic here, so it'd be covered.
That's right. Mm-hmm. Okay.
This is Michael Zembic. I have a question.
Go ahead, Michael.
You covered earlier just briefly the option of local health insurance, and the objection seemed to be was that a lot of the local plans would not fully cover a procedure. but I've noted that a number of the hospitals have plans which are specific to them. So for example, if you needed procedure A, whatever it might be, a fusion, a knee replacement, any type of surgical procedure, wouldn't that obviate that problem because the hospital that you're getting the procedure at is in fact the one charging you? And so they would charge something that's reasonable and customary that their own plan would satisfy.
Well, there are some local plans that's what we're going to talk about next, right at 8 o'clock here. We have a specialist that's going to talk to us about family medical care, which is an option, which is a local hospital copay type plan. So we're going to discuss that very shortly. Michael Stubbs, Army vet, TRICARE for life. Yes, Michael, you are covered in Panama. Several hospitals here will cover you for your TRICARE for life. It's also VA pharmacies in Panama. I keep looking at the transcription of it's VA pharmacies. Yeah. Okay. Well, Carla has joined us tonight, so we're going to talk for 15 minutes. Promise won't be any longer, probably less, about a product called Family Medical Care, which is underwritten by Pan American Life Insurance, which I'm sure you've all heard, and they're a big company, well known, and they offer services throughout Panama at many of the private hospitals, and they offer a copay type service that you pay for 30% of your health care, and they pay for 70%. Now, I am going to, first of all, mute everyone. Next, ask Carla to unmute herself. There we go. Hi, Carla.
Hi, how are you?
Hi, wonderful. So we're meeting Carla Gonzalez, who I spoke to Family Medical Care, and they advised me this is the person that should be on our Zoom tonight. She knows the most about this product, what it is, how it works, and who it's for. And after she talks, and we're going to hit her up with questions and stuff like that, and you're going to get Rod's editorial and everything we talked about tonight. So welcome to the call, Carla. We have over 100 people here anxious to hear what you have to say about this interesting product. So first of all, how long have you been in the insurance business here?
I've been in the insurance business for over 10 years now.
Oh, 10 years.
And working with this program especially. So yeah, I do know about the program.
This program has gone through a lot of changes. It used to be called, way back when it was Cherokee Hospital Plan, we used to call it.
Medic Service was the name.
Medic Service, yeah.
Yes.
It's a different plan. It's not for everyone, but it is for some people. That's how I always promote it. Some people that, it's lower cost, and it's it's still kind of what I call self-insuring, because you're going to have to pay 30%. But some people there's people moving here in their late 70s, early 80s, moving here. Well, they don't have any other options. They have to get a good plan. So, Carla, why don't you tell us a little bit about the company, Pan America, like who are those people? Family Medical, what hospitals are involved, and how the plan works. When you want to talk about the brochure, let me know. I'll share my screen. I have it up on the screen.
Okay, we can show the brochure right now, so we can all see the name, the insurance company, and we can kind of relate to it.
Okay, I got the
front. The name of the program is Family Medical Care. As you mentioned, this program works specifically with some of the best hospitals in Panama. In the city, they are working with Hospital San Fernando. In Chiriquí, they are working with Hospital Chiriquí and Hospital My Luis. The program is part of Pan American Life Insurance. This company is actually from the US, and it has been in Panama for over 100 years now. So they are the best in the health insurance field in Panama. One of the best, okay? We can move to the second page of the brochure. Okay. Some of the benefits are immediately. but they do have a waiting period of time for some other coverage. You will see the most important thing, you will see the emergencies, because when you get to Panama, you have to worry, what if something happens? If I have an emergency, where should I go? So that's immediately covered by the insurance. They have, as you see here in the brochure, they have a program where you have to do a co-payment. The policy covers 70% of most of the expenses. In some other cases, they do cover 50%, but you always have to do a co-payment, and it's usually 30%. It's an annual coverage. You have, it's, I think, a little down on the brochure, the amount of the coverage. It's $50,000 per year. I don't see if you can see it there, but it's $50,000 per year. Yes, it's right down there for each person that applies to the program. You will see here the rates are very affordable, and they change between 10 years. For example, from 50 to 59, you will have a rate. From 60 to 69 is another different rates, and these are monthly rates, okay? Another thing about this program that's very important is the pre-existing conditions. Most of the health insurance programs in Panama don't cover pre-existing conditions. So when you already have a diagnosis with this program, they will cover that pre-existing condition after 24 months of enrollment on a 50%, okay? And you can apply. The only reason they would not approve a policy if a person has more than 3 pre-existing conditions. You can have 1, 2, or 3. If you have 4, like in baseball, they couldn't approve the policy for you, okay? And another thing I can mention you about this program, it's very important because when you get into Panama, some of the insurance companies require that you have a residence. With this program, you can apply with your passport, even if you don't have a residence here in Panama. That's the passport, it's accepted by the insurance, okay? And to apply for this policy, depending on the age, they will require some tests and an evaluation. Starting 50 years old, they will require the test. If you are under that age, then we only have to fill in the documentation, okay? And the payments for this program, if you choose to do monthly payments, it has to be through a direct discount from a credit card or a bank account. If you want to do voluntary payments, it has to be quarterly, semi-annual, or the complete year of the program. That's a brief resume of the program. And I don't know if you have questions for me now that I can help you with.
Well, I'm going to first ask you some questions, then I'm going to open the floor. First of all, great. I get this every day, the elephant in the room. How come it stops at 70? This plan used to always be unlimited age. It only goes up to 70 now.
Yeah, that's a very good question. Okay, because of the pandemic, right now, the insurance company decided that they are approving policies, new policies, up to 70 years old. When you get approved, the policy is indefinitely. You can have it as long as you want to have it. But that's just for now. We are hoping that next year they will allow, as it was in the past, to enroll any age with no limits. But we have to wait from the insurance company. So right now, at this moment, you can apply up to 70 years old.
Yeah, I can tell you guys that a year and a half ago, it was unlimited. And then the pandemic hit, and they actually capped it at 60. And they recently bumped it up to 70 in, I think it was July or August.
Well, in July, it was up to 65.
Yeah, 65.
And about 2 months ago, it was up to 70. So we are hoping.
This is not coming from Carla. I've heard rumors about it's going up to 80 next month, but we'll see. Okay. Carla did not say that. My question is, I see some outside of the country stuff, or outside. First, let's talk about outside of the network hospitals. Let's say I'm in Chitray and I break my leg, like go to the hospital. Am I covered for that?
Yes, if you have an accident or an emergency and you cannot go to the hospitals that this plan works with, it will be covered, but through reimbursement. That means that if you're at Chitray, you will have to pay the complete bill for those medical expenses, and then you can submit the bill for reimbursement. And the claiming process right now is very friendly. Now you can send your claims through email, or you can submit the original paperwork at our office in Hospital Chiriquí or in Hospital San Fernando if you're in the city.
Okay. Outside of Panama, it's also reimbursed at 70% up to $3,500. So if you're on vacation, you get a little bit of coverage. Is that what it's telling me?
Yes. With this particular benefit, it works through reimbursement. That means that if you have and it's just for emergency. That's very important to be clear. If you have an emergency outside Panama, you can bring the bills back to Panama and submit them to the insurance. They will reimburse you 70%, but after the deductible, the $3,500 deductible. So it has to be like a big emergency. If it's less than $3,500, it wouldn't be covered by the insurance.
Yeah. Okay. Okay. You guys see everything here: dental emergencies, funeral up to $1,000. Actually, $1,000 is an expensive funeral in Panama. I've seen people get married for less. Diagnostic, outpatient, maternity, good for younger families. Families, just look at the price, guys. Come on. $46 for somebody in their 30s. And yes, you can have a baby for $3,500 in Panama.
Yes.
Not a problem. Sorry. Okay. Preventative maintenance. Okay. Eye surgery. This is eye surgery. That would be like cataract, stuff like that.
Correct.
Excuse me. Oh yeah, it doesn't. You're not covered until 36 hours, obviously, because people try to scam insurance companies. So,
yeah, 36 months.
Yeah,
not hours.
Same as hip and knee replacement. Okay, you guys see all the prices. The way these prices work is if you're a couple. So let's say you're both in your 60s. The first one pays 102, and the second one pays 80, like the dependent or whatever you want to call it. Okay. That is good. I'm going to unshare my screen and we're going to take some questions. Just let me get back to chat. Oops. And let's fix the allow people to unmute. Okay. Does anyone have any questions on this particular plan for Carla? In the email tomorrow that goes out with the replay, you're going to get this brochure and call Carla's direct contact details. I'm going to actually send it to you right now, or contact information to you right now. So anyone want to unmute yourself and ask a question here?
I have a question. And my question is this. So this one, when you look at the pamphlet, it says that it's unlimited. Like you said, you can only apply up to 70 right now. So if that even changes to 80. So right now we couldn't apply for that one either, could we, for 74?
Not today.
Okay, so
well,
let's say
it was 60 in June. It went to 65 in July. It went to 70 in October. You know, it's probably, you know, it could go to 80.
So what do people do then after that age? What insurance can you not get insurance after a certain age?
No.
So you have to live in a country and not have any kind of insurance?
Well, this here is what has always been available in Panama.
No, but what I'm saying is, so if we're going to relocate there and live there permanently, so after 80, let's say, so after 80, you cannot buy insurance anymore?
No. If you're enrolled in the plan, you have it for life.
Oh, thank you.
That's
Okay.
yeah, it's an enrollment age, same as the other plan. It's an
Okay.
enrollment age.
Oh,
They,
an
what
enrollment.
they do is they're reducing their risk. Obviously, they want people, you know,
Mhm.
in the plan a longer time, paying during those healthy years. So,
Okay.
you know, that's insurance companies. Yeah.
Okay, so you're thinking it may go to 80, which would be perfect.
Well, Carla didn't say anything, but it could very likely go to 80 within the next few months. Yes.
Thank you.
Michael Roop here. Can you hear me?
Hi there, Michael. Hey, Michael Roop, how are you?
Pretty good. Yourself?
Wonderful. Good to see you.
Yeah. It's cold here. So my question is for us, for the foreseeable future, at least, we could do no more than 6 months a year. My parents are elderly, so so we can't stay too long. We have very good coverage right now with health insurance up to 6 months out of the country between Medicare and the private plan that we have. Now, the private part, I was looking at potentially replacing that. We have to see how that works on this end. But okay, let's say we got to Panama, we got our pensionado, all this kind of thing, and we got into the plan before the cutoff age. Do we have to live in Panama for more than 6 months a year, or can we kind of go back and forth, and then our Medicare would cover us in Canada? We wouldn't touch the Panamanian, but we'd still pay for it to stay in the plan for when we got back to Panama.
Yeah, well, as Carla mentioned, I wasn't aware of this either, Carla. Danny, I think I addressed you wrong. You don't need to be a resident for this plan, correct?
No, you don't need to be a resident, and you can go back and forth.
So
but you will have to keep the insurance because it has waiting periods of time. So it's not like you can get it now just for 6 months.
Yeah, you have to pay.
You will have to do all the process of enrollment if you cancel the insurance after 6 months, and then you go back and then come back again in 6 months. So it's better if you keep it.
Yeah, it sounds like you're going to be over-insured, Michael, but so...
The idea would be to grandfather us into the Panamanian plan to be able to give us the flexibility if we then go to a longer period. But that won't be for some years ahead.
Yeah, for sure. When you get to a point when you're here, I'm going, I've told you guys this all, and I don't, and Carla's probably heard me speak too. If you can afford $300 a month each in your 60s, $350 a month each, I'm all for international plans that have no copay and no deductible. Like there's different plans for different people, different style of life. Danny was talking, he's working here as he's 60, but he's working online for a U.S. company, has no insurance in Panama. Well, he's not a resident here. So this sounds like it's perfect for him. Like some insurance is better than none. Like you said, especially in the private, these hospitals are all the private good hospitals we're talking about, guys.
Well, maybe I misunderstood, but I thought the international, you could only be out of Panama for 3 months.
No, internationally, you can be out of Panama 6 months, but you can't be in the States more than 3 months.
Oh, well, this would be Canada anyway.
Yeah.
You said Canada too.
Did I say Canada? Yes, same thing. U.S., Canada, and Brazil for some godforsaken reason. I don't know why Brazil isn't there.
So you can't be in Canada for more than 6 months of the year with the international.
No, you cannot be out of Panama for more than 6 months, and you can't be in the U.S. or Canada for 3 consecutive months, like any more than 3 consecutive months.
Yeah, okay.
Yeah.
So a little confused, but that's why I wanted things in writing.
Yeah. Any more questions for Carla on the family medical plan care? Family medical care.
Hi, this is Lynn. I've been unable to reach any of the numbers.
Carla, what is the age that when a medical is required? What's the age? Was it 50 or 60?
50. After
50.
50 years old. Yeah, someone was asking something, I think, but
someone was talking to me. You weren't very loud.
Yeah, you just, Lynn Walker. Go ahead, Lynn.
Hi, I'm sorry you can't hear me very well.
Okay.
I've been trying to reach the numbers that are listed in the brochure, and I've gotten bad results all the way around. Sometimes people can't hear me on the phone. Sometimes they don't speak English. I just need to talk to somebody about this latest insurance that you're discussing. And maybe email would be the best way.
Okay, I'm just right this very second, Lynn. I am going to pop Carla's email address into the chat.
Okay.
To everyone, and please send Carla an email tomorrow and said, as you see, Carla speaks perfect English. You can set up a WhatsApp or something with her, or.
Perfect, I have WhatsApp.
There we go, perfect.
Thank you.
Okay. All right.
Carla, I have a quick question for Carla.
Yes.
And I'm wondering about, with the age difference, the price of paying for, say, the wife is 65, the husband is 60. Does it go by the oldest person? Or say 70, that'd be a price difference, 70 and 60. If there's a price age difference, the wife, say, is 70, the husband is 60. Which one would be covered as the initial person? Can you put it under the younger husband and the older, or does it have to be under the oldest person?
Yes, it has to be under the oldest person. So the wife, if she's 70, she will be the principal in the policy, and then the spouse will be next with the family rate.
Okay, excellent, thank you.
Perfect, great question. Any other questions?
Hey, Rob.
Yeah.
Yeah. So there's a few of us who are not vaccinated against COVID. Are there any limitations for this policy plan?
That's a very good question. The policy right now, if you are over 60 years old, is requesting to have the vaccinations, 2 vaccinations to apply for the program.
Okay, thank you.
I didn't know that. Thank you for sharing that. Okay. All right. Any other questions, folks? I'm going to wrap this up with my summary here shortly. A lot of information. Like I said again, tomorrow you guys are going to get an email with the brochure, with everyone's contact information, what we talked about. Do you have any? Oh, yes. Go ahead, Karen. You have to unmute yourself. I'm trying to ask you to. There we go. There we go. Karen?
Thank you.
Yeah.
Thank you. My question is, we had heard from another party with regards to this insurance, though it had the requirement for being vaccinated, that you could provide a letter that would document your either religious or medical get a waiver for that anyway. And I just wondered if that's true or not. Thank you.
Well, right now they are requesting the vaccinations. They are not allowing anyone without that into the program.
Okay.
And then just to clarify with that family medical care, is it any hospital, any physician, any specialist, or is it limited to the 2 hospitals in David?
Oh, that's a very good question. Thank you. Okay, for hospitalizations and surgeries, it has to be in those hospitals. But for consultations with specialists, you can choose any of the doctors that are in Pan American Life Insurance Network. That insurance has a very large medical network with very good specialists. So yeah, for medical, like for consultations, you can go to any of those doctors. You can even choose a doctor that is not in the network. But if you choose a doctor that is not in the network, you would have to do the process of reimbursement for the consultation. I don't know if that answers the question.
Yes, that was helpful. Thank you.
Perfect. Is there, someone just asked, Carla, is there any coverage at all for prescriptions in the medications in this plan?
Okay, with prescriptions, the policy doesn't cover that. They only cover medicines when you are in the hospital or at the emergency room.
Any post-care prescriptions covered? No, just inside the hospital. Okay.
Correct.
Question?
Is there, does it cover ambulances to the hospitals?
Yeah, up to $350, I think it says right here.
Yes, correct.
Is there an ambulance service in Boquete?
There are some ambulances in Boquete, yes. There's not really a 911 service, but that's something that we always talk to our guests about. There are private 911 services here, which are great to have. English-speaking people that will get someone to your house whenever you need it. So, yeah.
Is that a dependable service?
Oh, that's 100%. It's the best. It's called Rodney Direct if you want to Google it. Just Google Rodney Direct Boquete. He's got a great website. He charges $80 a year, 24/7. And like do you speak Spanish, man?
No, I don't.
No, so you won't be calling for the police department or the ambulance or the fire department yourself, because the people
Right.
on the other end of the line do not speak Spanish.
Could you put a link in for that service?
Sure. Let me
Thank you.
Google his website. Yeah, it's a great service. He's been, I think, 12 years now. He just celebrated a big anniversary. Everyone loves him. He's a Panamanian fellow that started this service, and it's just like you get a placard for the front of your house, so to help identify you. Register through GPS, so they know exactly where you are, and they contact the appropriate service that you need and get you the help you need.
Okay, thank you.
Any other questions for Carla before we let her carry on with her night? Okay, I'm just going to pop for, this is in Cherokee Province, guys. I know of another service in Coronado. I can't remember what it's called. Oops, I just sent that to Dan accidentally. Hey, Dan. Dan's coming on one of our tours in May, I believe it is. That's to everyone, Rodney Direct's website. Well, Carla, I really appreciate you coming on here and talking to everybody. This plan, it's kind of been on our shelf because you guys dropped the age so low, with the pandemic, and now that it's back up to 70, a lot of people are seriously considering it. So I think you're going to make sure you guys, I sent you the email. It's in the chat. You're going to get it tomorrow. Please give Carla 72 hours to reply to you. This email is going out to our entire list tomorrow with their contact information. She might have a few emails to handle. So Carla, thank you very much for joining us. And
well, thank you.
all your questions, you guys, just email Carla and she'll answer them regarding this plan. And you sign up right here. Are you in Cherokee or are you in Panama City? I can't remember.
I'm in Panama City, but we do have a staff in Cherokee.
So if you're in Coronado, all that area, you'll sign up in Panama City. If you're come to Boquete, you'll probably sign up in Cherokee Hospital, correct?
Yes.
Yeah.
That's correct. Well, thank you so much for the opportunity and nice to meet you all.
Okay.
I'll be answering all the emails as soon as possible.
Okay. All right. So let us, last minute thoughts, anything not non-healthcare, directly to Carla or Magda. I believe in health insurance, guys. I know so many expats that are here that say, I just use the public system or I self-insure. Then I see the emergencies that happen and I see the GoFundMe start because somebody can't afford their hospital bills. Hospital care is cheaper here than the US. Like you saw a knee surgery for $15,000, as Magda said. Appendicitis, $6,000 to $7,000. I've seen hip surgery for $7,000. These are $50,000, $60,000, $70,000 procedures in the US and Canada. But still, are you prepared to be hit with a $15,000, $20,000 bill? If you're not, you need to be insured. Now, some people, honestly, they've moved down here in pensions. And we tell people, yes, you can live in Panama on $2,000, $2,500 a month. But when you're 70, can you afford to pay $1,000 in total in healthcare insurances? Maybe you can. But, you know, I even look at that myself. When I'm no longer traveling the world, and well, not that any of us have traveled the world in the last 2 years, but maybe moving to a cheaper copay type plan might be a smarter idea when, you know, once I hit 75 or something. You can drop your, we just saw the numbers. The 75 years old is $160 a month, I think it was, close to 70, yeah, no, sorry, $125 a month. Yeah. So, but you still, you know, if you got a $20,000 surgery, you're still going to be able to pay $7,000 of it. So I believe it should be insured. I like the worldwide, I like the international health plans. There's nothing to worry about. There's no out-of-pocket money. But as an alternative for people that are digital nomads here that don't have your residency yet, or that are traveling 6 months here, 6 months off, this is, I think this could be a supplement plan for some of you. It just gives another option for people over 75 when they bring the age up. So anyone else have any last minute comments?
Hi, Rod. Is Magda still on the call?
I see her there. I'm not sure if she's right listening there.
Yeah, for her plans, same question about the COVID vaccination.
Oh yes, Magda. Let's get it. We have a last minute question for you. Oh, her screen background is screwed up. It looks like you fell off your chair. Are you okay?
I am okay,
Okay.
but I had to leave for a minute. But the Worldwide Medical Plan is not requiring vaccination yet.
Okay.
But they might. They might.
But they might. Okay.
Okay. Thank you.
Yes, sir.
Okay. Michael, still confused about how long you stay in Panama for either plans. Stay in Canada. It's irrelevant, Michael, on the plan we just talked about, but on the plan Magda talked about, you can stay in Canada for 3 consecutive months. Then you have to leave. Then you can come back for 3 consecutive months, but not any longer than that, because you have to be in Panama for 6 months.
Yes, that's correct.
Thank you.
This is Phil. A question for Magda. How often are you at your Boquete office?
Sorry, I'm losing signal. What was the question?
I say, how often are you at your Boquete offices? Do you have a regular schedule? So if we go, we know when to meet, where we can meet you, when we can meet you?
I'm usually most of the time at the Boquete office, but I travel to Panama City also every month. I'd rather have you make an appointment with me at least 2 days before.
Okay, thank you.
Yes, sir.
I keep seeing in the chat people asking that they want a PDF or they want a copy of this plan. It's coming tomorrow. Be patient, everyone. There's an email going out with the recording of this call. It'll have all the documentation and contact information for our wonderful guests tonight who can help you solve that healthcare issue in Panama. So final thoughts, guys, before we get kicked off of Zoom. There's still 75 of you hanging on here. Any other comments, questions?
Hey, Rod, it's Debbie and James.
Hey, Debbie and James.
We just wanted to say hi.
Hello. Hey, guys, how are you?
Good. From September to remember.
Oh, yeah, September to remember.
That's all.
So many people from the past. Oscar and Megan just messaged. Okay, they have a bad excuse. They're drinking margaritas at a restaurant with a private tour couple. Oh, well. So they didn't make it to the call. They knew I'm the healthcare guy in the company, so they didn't need to be here. So, all righty. So
I don't know if it would be relevant, but Ron, I should ask, if we're in Boquete,
yeah,
and we develop concern or symptoms regarding COVID, do they have the monoclonal, medicines available for the, medication if something like that became a concern?
I'm not sure what the monoclonal medicines you're talking about, but
well, like ivermectin or the the intravenous medications that are done as a preventative for therapeutics for the.
Well, in Panama's hospital system, we had one of the lowest death rates in the world of cases admitted to the hospital. So they did a great job here in Panama of treating people, getting them in, getting them out. They have used everything, like all cases, whether it's ivermectin or hydroxychloroquine, right? Like they went through the whole procedure and used to what's best and got people cured. So we had a really good death rate. And the numbers in Panama, for those of you who are concerned, we have less than 100 people in hospitals with COVID in the entire country right now. We have less, I think it's, quote me on this, someone's going to call me a liar, I think it's 17 people in our ICUs right now. We have a bed capacity of 500. So, we're doing a great job. We have a 91 point something percent first shot vaccination rate right now of eligible population. That's over 12. 82 or 83% second shot. So it's probably why the country's been pretty well open to tourists and the public for the last over 15 months. We don't have COVID vax cards or whatever they call them in the States. The restaurants, bars, discos, stuff like that have a choice. If they want 100% capacity, they must require, they must ask for vaccine passports. If they want to stay with the current COVID system, which is 50 to 75% capacity, we're open to the general public. So it's really comforting here in Panama. If you guys are thinking of coming here, hey, if you're thinking, no, I'm throwing my plug until Zoom cuts me off. We did tours in Panama. 12 people are toured. We have one spot in the first third of next year in March available. Check us out, Retire in Panama Tours. But it's such a pleasure being here because there's no fight against vaccination or non-vaccination. Even our company, we respect people's rights. There's no fight against mask wearers or anti-mask wearers. It's just, it's just a very nice country to be in during the, I wouldn't want to be anywhere else during this pandemic than what I went through in Panama. Cindy, hey, Cindy from Saskatchewan, that's my hometown of Regina, Saskatchewan. Okay. There's the rate. All right, guys, I got no more questions. Perfect. It's nice to have you all on here. You'll get an email tomorrow, probably, depending on how long it takes the video to process. But it should be out in the early afternoon with a replay of the video, the brochure, both Magda and Carla's contact information. I appreciate you guys taking the time. Retire in Panama, Oscar and I appreciate you taking the time out of your night and joining us on this call. And we hope to show some of you Panama in the future. Have a good night.